speed has provided enough material for it. The material that has been provided for each topic sort of covers everything that is needed for the exam, and also gives you an overall idea of how what the specific topic is. Choosing the right platform, that's very important, because your material, that's whatever the material you will be having, that will only help you.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Amruth Reddy for scoring a topmost rank of AML 4 and CML 8 in DM Neurology as a Super Speciality exam of NESS November 2025. Congratulations to you.
Thank you, thank you, thank you so much, sir. Thank you so much.
So great to have you, and also want wish to share your experiences with us. And can we know a brief background history from where you started till date? What all you have done?
Yes, sir. Sir, I did MBBS from a private medical college, which is from Kurnool
Okay,
in Andhra Pradesh.
excellent.
Then I did my MD General Medicine from Kasturba Medical College, Mangalore. So I've finished my PG recently, sir. My tenure got done in February 2025. After that, I gave the INI in May 2025 to just get a hang of how the exam is gonna be. Then prepared for the November session. Gave the INI, and here I am. So
Okay,
that's,
fantastic.
yeah, yes, sir.
Now, can we know why your interest and was for towards neurology?
Sir, it's like I have been very clear about which branch should I be going for, right from the postgrad days, because I did my MD from, as I said, from KMC Mangalore, which has a government hospital attached to it. Like it's the Venlock District Hospital, one of the largest government hospitals in Karnataka. There we used to get a lot number of cases who which used to be learning lesson for us. Like I have seen throughout my entire 3 year postgrad course. I have seen all the cases that we currently are reading for the exam, for the INSS exam, like the spinocerebellar ataxias, demyelinating disorders, NMOSD, multiple sclerosis. We have seen a lot of ALS cases. We have seen like almost every possible diagnostic cases that we are currently preparing for the INI. We have seen almost every case in our postgrad days, right from the beginning. That made it for me more clear for me that I want to take up neurology only as a primary subject for the DM course. And also it's sort of instinctive as well, because when you see a lot of cases from all the branches, like there'll be a gastro case getting admitted in your wards, there'll be a cardio case getting admitted in your wards, a lot of neurology cases are getting admitted in your wards, and you instinctively you tend to go towards what you're interested in more, sort of like for me, if I see a neurology case in my ward, it's the interest goes up till, for like starting from following up the case, taking the case history, making up a diagnosis, making up a provisional diagnosis, following up through the MRI scans, everything, until unless there's a proper diagnosis that is put for the case that comes to our ward. I always used to feel a little unhappy if the case goes out of our ward without a diagnosis. So that's sort of instinctive. Like you tend to go towards what you are interested in more, because uh, its medicine is very vast, I feel. You'll have a lot of different aspects coming into the picture, but it's like you what you're interested in, you will get to know, but because it's a 3 year course that you will be spending in with the patients. So this is the thing, sir.
Great. Very nice.
Yes, sir.
Now, once you decided to do neuro, then what you did to preparation strategy, what all you prepared, how you prepared to reach this rank?
Yes, sir. Yes, sir. Sir, as I told you, like I gave as I finished my tenure in Feb 2025. So as soon as I came out, I gave the May INI session to just get a hang of how the pattern is going to be, like what I should be reading through for in order to get to that. And also spoke to few of my seniors who actually guided me through the process, like how there are two different steps that you have to go through. First is the the theoretical marks that you'll be scoring, and then you have the interview phase. Then after getting a clear idea of how the exam is going to be and what exactly should I be doing, in order to get to that, I have made few calls to few of my seniors, which to find out what would be the better source, to prepare for the INA examination. And as most of them suggested, I and as Nagendra sir, who's currently faculty of Speed Institute, he is also from KMC Bangalore. He was my super senior in KMC
Okay.
Bangalore. Yeah, yes, sir. He's also from KMC Bangalore. So yeah, he just taken a brief period for of 1 week free trial to just go through his videos, to just know how the the material is going to be, because INA is such an exam where it's like, the number of seats are very limited, and you need an extra edge over the other contestants that will be there for the exam. So as soon as I went through the tutorial, the trial period videos, a few of the important topics that I went through, and the material that has been provided for each topic, based on that, I understood that it's sort of covers everything that is needed for the exam, and also gives you an overall idea of how what the specific topic is. The INI question paper, you can't predict how the paper is going to be, because in the same year, for the two different sessions, the paper will be completely different. You can't actually tell how the examiner is going to frame a question that comes even from the same familiar topic. So I always felt that it's best that you have an overall idea of what the topic is, rather than concentrating on a few specific points in a particular topic. So in that way, Speed has provided enough material for it. So that actually gives us an extra edge, to cover up a specific topic, and also various aspects, like in neuroradiology, the EMG, EEGs. Uh, NCS, which we usually do, as an MD medicine postgraduate, we usually don't get exposed to all these kind of DM level aspects. So having an extra edge on in all these particular topics is very important, to have an overall idea of how the overall idea of the subject as such, which will help which will give us a great deal actually to to go for the exams such as the INI. Yes, sir.
You have analyzed perfectly, because we
Yes, sir.
always keep the standard of the preparation more than the standard of the exam. So
Yes, sir.
if the
Correct.
student prepares more than the standard of the exam only, then he can give the exam.
Correct. Correct, sir.
Even to the standard, then he has to expect the results. When he crosses the standard of the exam, his preparation goes up, then probably he will be able to take whatever he wants.
Whatever. Yes, sir. True. True.
So
True.
then we also see to that, because it changes every 6 months. The
Yes,
entire
sir.
concept, the updates happen. So we always have a practice of cycling every day. There should be some update in the
Yes.
concept. Something is to be loaded in the
Yeah.
app. so that the students are on the move, they are engaged. So that's the reason why we do that. And also we look into who are the people who have cracked it recently, how, what is that the trend is going on. I mean,
Correct.
Nagendra himself is a topper, is a first ranker.
Yes, sir.
And so he knows what it is, what they're going to ask, how they're going to ask, where they're going to ask. So the subject knowledge in depth will be more. That's the reason why it has been kept that way. I mean, you explained exactly the way we did the course. I mean, we could hear from you.
Yes.
Thanks for appreciating it. Now,
Thank you.
can we know about the paper? I mean, what was this paper was up to? I mean, what did they ask and that, and also how did you prepare for interview and what happened in the interview? So that you can cover, it'll be great.
Yes, sir. Yes, sir. Actually, the previous session that I gave, the May session, compared to that session, like usually what you expect is at least a few areas will be covered from the previous exam. As I pointed out earlier, that the paper was completely different from the previous session. That it's the same year, two different sessions, but the papers were completely different. The questions came, the were framed in a way that as soon as you read the question, it looks very familiar to you. It looks very familiar. The options will look familiar to you. It looks like you've read it somewhere, but you can't exactly mark unless you have a thorough knowledge of entire concept, like instead entire conceptual knowledge of that particular topic. Like they have taken it from Harrison's tables. They have taken it from a corner. They have taken, yeah, there were questions even from pathology as well. Like in ALS, they had asked about Hirano bodies and also, and there were almost 12 to 13 questions from epilepsy itself, which is actually quite surprising, because that actually is the rank decider, because 13 questions from a single topic, that's like very different. And also we usually expect some questions from the stroke guidelines, because we all know that thrombolysis in stroke, it's a hot topic, and there has always been a question on thrombolysis in stroke, and also the contraindications, indications, a lot of things that come up to this, and also other aspects of stroke, such as in your intracranial hemorrhages, all those. But this year they didn't ask any of those questions as such from the that you we usually expect commonly from stroke. They asked different questions, like such as in sickle cell, disease with stroke, the management, how it goes up. And also there was a question on other different aspects of other different parts of stroke, but it was not something that you usually expect. And also this is what this is what I have been telling, sir. Having a broad idea of entire subject as such, like covering the entire subject, that's what your material, whatever you'll be going through, that itself should provide you enough knowledge, to answer the questions, even if they frame it a different way or ask something different, far away from what has been done before. Because the difficulty level keeps varying. The previous cutoff, if you see, the cutoffs were the highest rank mark was around 67. Now it's 63. That it differs a lot. And also there were a lot of questions on ALS as well, which we usually don't expect, because ALS is such a small topic. We usually expect one or two, but there are around 3 to 4 questions from ALS. And also there were few topics which were not covered as such, because such as ataxias were very important. They didn't ask any questions in from ataxias, and a few questions from dementias, which also surprisingly from the areas where don't expect, like few tables from dementias which were covered in the Speed app as well. These I felt based on this, I felt having core knowledge about the subject is very important than just covering the important concepts, because it keeps on changing. The pattern keeps on changing, and the examiners, they also tend to mold themselves as per the new students that come in. A lot of students who come in for the INI exam that they give, because it's a central institute exam, and it has to maintain their that standard. That's why having a holistic idea of the neurology subject as such is very important. And also the material that the Speed provides, that is also the makes a lot of difference, because you will, even if you don't know any answer, you will be able to rule out based on the knowledge that you have from the material that you read from the Speed app. That's what. And also, sir, for the second part interview round, it will be very brief, because the time that you usually get is less than 10 minutes, around 5 to 10 minutes. You will be asked questions, and you have to be spot on. Like, you have to give the answers right on, and there won't be they won't be waiting for you to just answer, to think and answer. It has to be like very instinctive, and you have to just give an right answer. And also the questions that will be asked for the interview round, they'll not be based on the theoretical knowledge that you have. It will be completely clinical, because the I was asked two questions for my interview round. Departmental assessment. The one question, it was about TB meningitis, the MRI that they have put, and the brief history mentioning about the complications in TB meningitis, obstructive hydrocephalus, which was a case which we had in our wards. The history, even the age of the patient was exactly the same.
Okay.
Yeah, it's like it was like I was just reading through the case that we had in our wards when I was a postgraduate. For the same patient, we had actually started ATT, and we had to do shunting. All these are the clinical aspects that you go, having an idea of the subject as such, and it comes a great deal what you do in the wards. Just being aware of what we are actually doing in our wards and during our postgrad days. It's the exact same case. Even the age was same, and also we see a lot of on the second case, it was an IC bleed, hypertensive patient. And the CT is weak. We see almost 10 to 20 of such cases in every day, IC bleeds. That means the same CTs, that the basal ganglia capsular bleed, that we usually see in our wards. It's having being aware of all these throughout your postgraduate days. I think that's enough knowledge that you will be able to gain, to even ask even the questions that they'll ask. You it it you can read all these. It's not like you can't read all this theoretically, but when you know, and when you have practiced it during your postgrad days, it sort of comes instinctively. You don't even let the examiner finish their question. That is what I can put it as, sir.
Great, great.
Yes, yes, sir.
So what is the message that you want to give for future aspirants of neurology?
Yes, that's what. Sir, I personally feel having an idea about what you exactly want to do, that is very important. For right from the beginning, during my MD postgrad days, I was sure that I it's either neurology or nothing for me. So having this kind of clarity of thought, about what you want to do, is very important, and you will have ample of cases in your words. You can just go through everything and figure out what you exactly want to do, what areas are you interested in. So this is very important. And also, once you are clear about what you want to do, the second part comes is where you want to do it. It's like there are a lot of institutes, great institutes in our country. Central institutes. There are very good institutes that have high volumes. There are very good DNB centers. But where exactly do you want to do your subject, as like having just finding out from the seniors who are doing in such institutes. My seniors who are doing at Nimhans or AIMS Delhi, Nagendra sir. Finding out about the work that happens there. What is the level of work that is happening there in your particular field of interest. Finding from them what exactly is the difference between that particular institute and other institute. This actually helps you motivate yourself, because at the end of the day, no matter what comes into the picture, it's what you want that motivates you. So if you are not clear about what you want, then I don't think you will find any motivation from anyone. And also, choosing the right platform, that's very important, because your material, that's whatever the material you will be having, that will only help you to this is a very this is an exam where you have a very narrow edge. You could be losing a very great institute which is 1 or 2 marks, because the paper is itself is for 80 marks. So choosing the right platform is very important. And this is what I suggest, sir. Like having an idea of what you want to do, where you want to do, and which platform you want to choose, for the particular target that you have. This, I think, is very important. Yes, sir.
So you took a 1 week of a trial and took a right choice of a platform.
Yes, sir. Yes, sir. That's it.
Huh?
Yes, sir.
Because I mean, today is in the market, it's very difficult to choose.
Yes, yes, sir. That's true.
Huh?
Mm.
So
That's what, sir. Mm. My seniors also guided me in the right way, so I'm thankful to them. Yes,
okay.
yes, sir.
So in my experience of last say 8 years of this NESS and NEET program,
Yes, sir.
and the students who want to excel in a institute level exam,
Yes, sir.
they choose speed. So rest they're not keen in going through this kind of a learning. They don't
Mm.
choose speed. So we have seen in our past experience, and we also feel that this platform is for students who want to excel in the super specialty and to apply that onto their patient in future.
Yes, sir.
So great, and thanks giving. And whom
Thank
all
you,
you
sir.
want to thank,
Thank
you
you.
can use the platform to thank. They helped you in your career so far.
Yes, sir. Sir, I would like to thank my uh, professors from my postgrad institute, KMC Bangalore, because that has given me the platform to explore and find out what I am interested in, what I want to do further in my life. I would like to thank all my professors of KMC from KMC Bangalore, who have always uh, challenged us in to perform academically, which always has driven us to learn more and more. And also the alumni that we have there over there, the seniors who have guided us, uh, all these people, to have having having made the right choice, landing up here. And also the platform, the speed platform, for providing everything that yeah, I need for achieving that. uh, I would like to thank all these people, and thank you so much, sir. Thank you so much.
Great, doctor.
Thank you, sir.
Again, wish you all the very best and all the success for a great, wonderful, and amazing career
Thank
in
you.
the
Thank you so
specialty
much.
of DM Neurology. And
Thank
as you are inspiring us today, you will be keep inspiring always. Best wishes for that.
thank you, sir. Thank you so much. Thank you.
All the best. Yeah.
Thank you, sir.